Hello, everyone, and welcome to OPG Hub. I'm so excited today. So, today, with our morning dose, and I'm so excited that you're joining us to listen. So, do me this, Anna. Kindly share this video to your loved ones and friends so we all learn from today's discussion. So, let's dive into it quickly. Today, we're going to talk about headaches and usually why you wake up every blessed day having headaches. So that's what we're going to talk about today. So, I hope you're fine. How's your night? All right. You can drop a comment in the comment section and give a like and share all to many as you can. I really appreciate. So let's start with the headache. So for us to understand headaches, I want us to talk a little bit about the brain and some other structures. Then we can connect all to talk about headaches. So let's begin. Now, the brain, as you see, actually does not have pain. Oh. It does not have pain. So if you are saying my head is aching me or my brain is aching me, there's nothing like my brain is aching me. That's the first thing I want you to understand. The brain does not have pain receptors. Okay. Now, however, the brain is surrounded by some structures, like a structure like something like a taro, which we call the meninges. We call some the blood vessels. We have some as the muscles, in the head, which all are connected in a way to protect the brain. And these 10 structures I've mentioned, they have what we call the pain receptors. So once they have pain receptors, that means that they're able to pick up pain signals and then they're able to send it for interpretation. And the brain is the one that interprets what those surrounding structures feel. Do you understand what I'm trying to say? Exactly. So with that said, the whenever there's a pain or the pain receptors of the blood vessels surrounding the brain, the nerves, the other surrounding structures kind of stretch, become inflamed, or there's something compressing them, then the pain receptors over there now picks the pain up. When they pick the pain up, they send the pain through a telephone wire or what I call a telephone cable, which is called a trigeminal nerve. Now, this trigeminal nerve is actually the pain pathway for the head and the face. So these pain receptors picked up the signal, send them through the trigeminal nerve. Once they get to the trigeminal nerve now relays it into the brain stem. Okay, good. So the trigeminal nerve now, I'm taking it again for you to understand. So the pain receptors now pick the pain, the structure surrounding the brain picks the pain and send these pain signals to the trigeminal nerve. Now, this trigeminal nerve, as I said, it's a nerve that carry pain from the face and the head structures. And then this trigeminal nerve sends these pain signals to the brainstem. Inside the brainstem, it relays it to what we call the nucleus caudalis. Now, once that nucleus caudalis in the brainstem receives these pain signals, it does a good job by then sending the pain again upwards to what structure in the brain? Thalamus. So the thalamus is like a train station, it's like an exchange place. So the thalamus then receives that pain signal that has been um, referred from the nucleus caudalis. Then the relay station, which is the thalamus then sends this pain to the brain. Do you get a picture? So it's not directly from those pain receptors straight to the brain. No. So it's from the thalamus to the brain. Now there's a certain part of the brain which is called the cortex. To be more specific, or to be more specific, the part of the brain that controls or that receives now this pain is called the somatosensory cortex. Now this somatosensory cortex now kind of feel the pain, interpret the pain, and then you begin to feel your head is aching you. Do you get it? Now, sometimes when the brain is interpreting these type of headaches, it then associates it with some nausea, sweating, sometimes, yeah, those are some like weakness and stuff. So basically, that's how headaches comes about. So it's not that the brain itself feels the pain, but the brain just interprets the pain signals from the surrounding structures, and that is how come you have headaches. I hope that is clear. So for you to have a better understanding, sorry. So for for you to have a better understanding, I said the brain, the structures surrounding the brain, the trigeminal nerve, then the relay station, then back to the brain. So the brain, the trigeminal nerves receives the pain signals and transport it to the brainstem, that is the um, nucleus caudalis, back into the relay station, that's the thalamus, that's the control center. Then from there, it goes back to the cortex of the brain, specifically the somatosensory cortex of the brain for interpretation. Then the person begins to feel the pain, which is called the headaches. We have two types of headaches. We have the primary headache and the secondary headache. The primary headache is as a result of the primary headache is actually the headache as a disease, and the secondary headache is headaches that are manifesting or as a symptom as a result of an underlying cause, like a vascular problem, an infection of the brain, infection of the meninges, all those kind of stuff, or maybe from stroke, from I mean from stroke. Basically, let me just say that's for the purpose of this, and other few things like medications and stuff. So those ones are secondary headaches. So that means that the headache is not actually the cause, it's actually an underlying cause that is causing the headache. But for the primary ones, the headache is as like a disease, like the migraine, thunder, um, like the migraine specifically. So let me just put these ones for you to understand. I hope you're understanding what we're talking about. Yes, so that's how come headaches comes about. So I hope you have understood me. So this is the morning dose. We talked about headaches today. So this is the reason why sometimes when you wake up in the morning you feel headaches. I'll explain myself and I'll get some time to explain more on migraine, because I know a lot of you have migraines. So do me this favor, kindly share this video with your loved ones and friends. Tell them that this is morning dose with Dr. OPJ. Morning dose with Dr. OPJ. Morning dose with Dr. OPJ. All right. Let me share something small also with you guys. Okay. So can you do me the favor? All right. So thank you so much, guys, so much for joining. I hope you have a wonderful day. Even as you step to your day with our prayer, that God will help us all to live good, well, so we can have a peaceful day and then come back to our homes and then wake up again tomorrow morning for an early morning dose. Until then, thank you so much for joining, and I really appreciate you. Bye.